Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. Today's episode will be a quick one, and it's a very simple topic. We're going to talk about what do you do when you have a stool test that's positive for blood, but you've recently had a colonoscopy. And what we'll do is we'll review the purposes of checking someone's stool during a physical exam for blood in terms of colorectal cancer prevention. And also we'll discuss the strengths and weaknesses of this technique when compared to colonoscopy. We'll talk about a quick patient case, and we'll discuss the utility of checking a stool guaiac test or a stool blood test after someone has had a colonoscopy within the past few years. Before we get to the patient, I must inform you that the following presentation is based on a real patient case. Some of the details have been changed to protect patient privacy. So this is a quick case today. We're going to talk about a 52-year-old woman who recently saw me in the office for guaiac positive stool. And a guaiac test is just the name of a certain type of stool test that most people are familiar with if you've been to the doctor and you're over a certain age, especially some of the older folks who are listening, because that's the test that they used to do for colorectal cancer screening. The doctor would do a rectal exam, basically would put a gloved finger into the rectum during a physical exam. Sometimes there's some residual stool, and they would use this little card to see if there is any blood in the stool. We're talking about blood that's invisible to the naked eye, not blood that you can see in the toilet, because that's a whole different story. This is looking for what's called occult blood, something that does not show up in the toilet that you can't see with your eye. And there's been a newer version of this stool test. It's not called a guaiac test anymore. It's called an immunochemical fecal occult blood test, and it's a much better test. But either way, these are non-invasive tests that you do to see if there's occult blood or invisible blood in the stool. So this patient went to her gynecologist for a yearly checkup and had a routine pelvic exam. And during the pelvic exam, some gynecologists perform a rectal exam with the purpose of looking for rectal cancer and checking some other factors, but also to check the stool to see if there's blood in the stool, because part of primary prevention is just sending people for their colonoscopies and also checking to see if they have blood in the stool, which would make them want to go get a colonoscopy even more. So this patient had that exam done, and she came to see me because her stool occult blood test was positive. Now, the catch here is that she had a colonoscopy with me about 2 years prior. Now, what do we do? She just had a colonoscopy only a couple of years ago, but now she has a trace of blood found in the stool. Do we need to repeat a colonoscopy? That's the ultimate question, and that's why she was coming in to see me. So to answer this question, we have to look at the stool occult blood test in a little more detail. The stool occult blood test is an old-fashioned test, and it was studied basically to look at the utility of using a test like this to prevent colon cancer. The bottom line is it's really not a great test to prevent colorectal cancer. If you take a bunch of people who have known cancer, if you take 100 people who have colon cancer, put them in a room, and one by one have them check a stool occult blood test, you'll find that only about 5 or 7%, or so only 5 or 7 of those people will actually turn that stool test positive for blood at any given time. Now, if you repeat enough of them, you'll pick up more people, but a spot analysis of just one stool occult blood test is very, very insensitive, meaning it will miss most cancers by far, the vast majority. If you do a few of them at home, that's considered a screening type test where you do 3 of them in a row, but that's very old-fashioned, and it really should not be the standard of care nowadays. Now, the newer test, the immunochemical fecal occult blood test, is a much better test. It's much more sensitive. The methodology that it uses to pick up blood can pick up much smaller amounts of blood, and it's more useful in terms of colorectal cancer prevention. And if you choose to, you can do a fecal occult blood test using the newer immunochemical test, and that is like a substitute for colorectal cancer screening, although you have to repeat it very frequently. So knowing this, how do we answer this question? Do I need to repeat a colonoscopy on this patient that just had an exam 2 years ago? So when she came in, I looked back in my chart and I found her colonoscopy report. We did a good exam, meaning it was adequate prep. The prep was good or excellent. The scope was passed all the way to the end of the colon, called the cecum, so we completed the entire exam. And we took our time withdrawing the scope, at least 9 minutes or so, looking around for polyps, and found nothing. So she had a good quality exam and nothing was found, and that was done 2 years ago. Now that is supposed to prevent colon cancer and protect her for about 10 years. So now she's here 8 years early, trace amount of blood in the stool found on the gynecologist's rectal exam. What am I supposed to do? So whenever we're confronted with some uncertainty, it's a good time to look at the literature. And I remembered a study that was done when I was in training. And the author of this study was a gastroenterologist, or still is a gastroenterologist at NYU, and he's an excellent physician in every way. He was a mentor to me and was an asset to my training in a big way as a gastroenterologist. So this study was done by Dr. Fritz Francois, and it was performed at the VA in New York, the VA Medical Center in Manhattan. So this study was done on about 1,100 male veterans for the most part, and they took patients that were referred for a positive guaiac test or a positive occult blood test, and they stratified them based on their time of their last colonoscopy. Did they never have a colonoscopy? Was it done more than 10 years ago? Was it 5 to 10 years ago? Or was it more recently within the last 5 years? And then they looked at what they found on their new exam, and they found if you had a colonoscopy in the past 5 years, it was a very, very low chance that you're going to find anything significant on the new colonoscopy done for this positive guaiac test. Now that changes if you've never had a colonoscopy. They found lots of pathology. Up to 30% of patients had advanced polyps, which are high risk of turning into cancer. And when you got closer to the date of your last colonoscopy, if you had your colonoscopy within the past 5 years, there was only a 1.1% chance that they find anything relevant, any type of advanced polyp in a new colonoscopy. And none of those patients had cancer. So basically what they found in this study at the VA was that if you had a colonoscopy within the past 5 years, you were pretty much well protected from developing colorectal cancer, regardless of what you found on a stool guaiac test. So why do it? There was only a 1.1% chance that you would find anything significant by repeating a colonoscopy, meaning if you took 100 people referred for a positive guaiac within their past 5 years of their colonoscopy, you're going to subject about 99 of them to an unnecessary colonoscopy to find 1 polyp and 0 cancers. So that study was published in 2015, and there's been some newer information or some newer research in that field. And there's an article that was published in 2022 that I'll link in the show notes as well. And this is called To Scope or Not, the Challenges of Managing Patients with a Positive Fecal Occult Blood Test After a Recent Colonoscopy. So clearly this is a problem that comes up, and people are looking into what to do. Now, this study was a little more diverse. It was done in Australia. It included about 1,050 patients, and they looked, and it was about half male, about half female. And they looked at the same clinical situation. What do you do with patients that were recently found to have a positive occult blood test? Now, this study used the immunochemical occult blood test, so it's even more of a sensitive marker. So if you had a positive immunochemical blood test, there's a much higher chance they're going to find something significant because it's just a much more sensitive and specific test. Now, what did they find? They found people that had a colonoscopy within the past 4 years. None of them had colorectal cancer, and only about 0.6% had an advanced adenoma. So that's even lower than what they found in the VA study. So when you take all comers, both men and women, who had a positive immunochemical occult blood test, and you do a colonoscopy on them, it's a very low yield test if their last colonoscopy was done within the past 4 years, with a 0.6% chance of finding something significant like a large polyp and a 0% chance of finding a cancer. So with those statistics, why even do it? You're submitting, again, 99% of those people to an unnecessary colonoscopy within that time frame. Now, these authors also found the same situation where if you never had a colonoscopy, there was a significant chance of finding something like cancer or a large polyp. But if you did have a colonoscopy, the closer you got to that date of your colonoscopy, of your previous colonoscopy, the more likely you were going to find nothing. So that's also reassuring news, and they compared their research or their findings to other studies that were done similarly, maybe with different populations of people, and they found about the same thing. Basically, if you had a colonoscopy within the past 4 to 5 years, you were protected from anything significant. They also cite some other studies that are possibly conflicting, showing a slightly increased risk of colorectal cancer after a positive guaiac. One study showed a 2% chance of finding cancer after you had a positive guaiac test. One study showed a 3.8% risk of finding cancer if you had a second colonoscopy after a guaiac test, and one study showed a 2.1% chance of finding cancer if you had a colonoscopy after a positive immunochemical occult blood test. So slightly higher than the 0.6%, but still not ridiculously high numbers. But those numbers do get into the significant range, so if you had a 4% chance of having cancer, a lot of people would say that it's probably worth doing. So there's a bunch of different numbers out there, but the majority of them are very, very reassuring, showing that there's a less than 1% chance of having a polyp and a very, very low chance to, approaching zero of having a cancer if you have another colonoscopy. So what do we do? Again, with this patient, we're back to the same clinical situation. So I can counsel her and say that studies show that there's a very low chance of you having anything significant if we repeat a colonoscopy at this time. But what I should also mention is that it depends heavily on the quality of the index colonoscopy that we're referring to. So if you had a high quality colonoscopy and the guaiac test is positive now and it's only been about 2 years, the chance of you having significant pathology, either a really large polyp or a cancer, really approaches zero or less than 1% according to these studies. But if you had a low quality exam, and we'll define what that means in about 2 seconds, then who knows? Because low quality exams are low quality. There's a very high chance that you've missed something or that your doctor missed something. And how could anyone say that after a low quality exam that you're protected from anything besides maybe a bill from your doctor's office? So the point is, you have to know the quality of the index exam. If you have a gold standard, that gold standard has to actually be good and not be a junk study. So how do we look at the quality of a colonoscopy? These are well-published guidelines out there talking about colonoscopy quality, and it boils down to about 3 factors. The first factor is you have to see a doctor who has a high adenoma detection rate, which means that if you scope 100 people, you're finding adenomas, which are precancerous polyps, in about 25% of a combined population of men and women at the bare minimum. And I've reviewed this in a previous episode, but it's going to be something that we're going to talk about all the time because colonoscopy quality is really what defines a protective colonoscopy. Otherwise, you're just wasting your time and subjecting yourself to discomfort and risk. So high adenoma detection rate is the most important thing to look for in an endoscopist. It's not advertised anywhere. You have to ask your endoscopist, and you have to hope that they track their adenoma detection rate. If they don't, you should run away. And if they tell you some low rate that makes no sense, like 5%, or some ridiculously high rate like 92%, you should also run away because they made those numbers up. But if they give you a reasonable number and it's above 25%, then at least you're dealing with someone who has a record of quality. Now, that number can approach higher than that. Some of the studies show that number approaches 50% in some of the best adenoma detectors out there. But if you're dealing with someone who's in the 30s to 40s, you're in good shape. So you should look for a doctor who has a high adenoma detection rate. That's the most important thing. Things to look for after your exam is that the exam was done with completion, meaning you had a colonoscopy where they examined the entire colon from end to beginning, or start to finish, or however you want to look at it. But from the rectum to the cecum, which is the very end part of the colon, you have to make sure that they found the appendiceal orifice and the ileocecal valve and maybe the terminal ileum to guarantee that that end of the colon was examined fully, because missed cancers and missed polyps happen where you don't look. So if you don't get to the end of the colon, you don't see the polyp or the cancer there. Again, it was not a part of your colon that was protected, so it was an incomplete exam, and you cannot hang your hat on the quality of that exam. Now, that complete exam to the cecum also means that the bowel preparation was good or excellent, considered adequate to detect polyps. So if the preparation of the bowel, meaning the clean out, which is really up to the doctor to inform the patient and to prescribe a good prep and to make sure the patient understands the prep, but also up to the patient to make sure they do the prep adequately and find something that works for them and follow the instructions and follow the diet and all that stuff. So the prep has to be good or excellent, and the doctor has to be able to see small polyps on the exam. So if you go to a colonoscopy with a really well cleaned out bowel and your doctor got to the end of the colon, which good physicians should do 95 to 99% of the time when they do a colonoscopy, then you should be protected as long as you go to a physician who has a high adenoma detection rate. And that's the one thing that you can ask about before your colonoscopy. So if you go to a quality individual, you have a high quality exam done, and all those parameters are met, then you are protected. And if your doctor does a occult blood test on you when you're not looking one day, you can probably ignore it with the big caveat of, what if you're that less than 1% and something was missed despite the best circumstances? Now, the other thing is, what if you had a colonoscopy with a lower quality physician, or they didn't finish the exam, or the prep was not that great? Then what do you do? And I think in that situation where you had a lower quality exam, you have to just repeat it, because there's nothing you can do that's going to undo that positive occult blood test. So if you have a low quality exam, or you're not really sure, or you can't find the report, or the clean out was not great, and you had a guaiac test or an occult blood test that was positive, there's really no right answer here, but I think you have to just repeat the colonoscopy. But if you had a really high quality exam, high adenoma detector, and you had a good prep and you had a complete exam, you can likely ignore that guaiac test and maybe repeat your exam 5 years after the colonoscopy and not wait 10 years. So these things are all individual decisions that you make with your doctor. It's a doctor-patient decision. You have to talk about all these things. You have to look at the patient's history. Is there a family history of colon cancer? Are there any vague symptoms that you may be missing out on? Do they have vague abdominal pain or other issues? Are they occasionally seeing blood in the toilet? Has their bowel habits changed recently? Are any of those things true? Because that kind of throws you into the category of wanting to do the exam more than ignore it. But essentially, it is a decision that the patient and the doctor make together based on all those factors, based on the quality of the last exam, based on the patient's anxiety level, and all that stuff together. And what did we do with our 52-year-old patient above who came in with this guaiac test that was positive? Well, we talked about it. And we talked about it more, and we talked about it a little more, and then eventually we decided to just repeat the thing because she was anxious about it, and there's really no other way to know what to do here. I can talk about the data, but the data is not comforting, and when you're sleeping at night and you're thinking about, is there some cancer growing in there? Did someone miss something? The data of these studies does not really help you sleep at night, and sometimes we end up doing exams that are low yield or possibly even not necessary. And you don't know that until you do the exam and you find out. So it's a difficult decision, and it's comparable to Pandora's box. You open Pandora's box when you do these unnecessary rectal exams, which brings us back to that original situation, why that patient had the rectal exam. She went for her annual with her gynecologist, and she had a bonus rectal exam in there. Now, should a gynecologist be doing that? That's probably the bigger question. And if this guaiac test was never checked, this patient would probably be fine and would not have this anxiety about having blood in the stool. Was it worth checking that guaiac test? Should we check guaiac tests if someone has had a colonoscopy with a high quality exam done in the last 5 years or so? I think the answer to that question is no. So if you're a patient, if you're a gynecologist or a family practitioner or someone else in healthcare that's checking stool guaiacs for any reason, perhaps you should ask the patient, hey, have you had a colonoscopy in the last 5 years? And if they say yeah, then you may want to defer that test because it's a low yield test and it leads to a lot of unnecessary colonoscopies and unnecessary anxiety down the road. Now, if that patient said, yeah, I think I had a colonoscopy 7 years ago, 10 years ago, or I never had one, or I don't want to have one, those are great patients to do a guaiac on because you'll capture some people who have pathology and get them in for a colonoscopy, which ultimately is the thing that will find the polyp or the cancer and give them a chance. And that's what all those studies also supported, is that the people who did not have colonoscopies in the past or had one more than 10 years ago, those people who, when they had guaiac tests, definitely should have a colonoscopy because those were much higher yield. And in some of the studies, they found large polyps or cancer in up to 30% of those people. So that's a lot of people. So if you have not had a colonoscopy or if it was done more than 10 years ago, the stool guaiac test is a great move, unless the patient just wants to go for a colonoscopy because that's even better. All right, so that's the end of the episode. Short and sweet today. Hopefully you enjoyed listening to this, and hopefully it was helpful in some way. Even if you just learned about how to do a high-quality colonoscopy, and maybe you'll tell your gynecologist to stay away from the rectum next time because you had an awesome high-quality exam just recently, and you don't want any stool guaiac tests clouding your mind when you sleep at night. All right, so if you like this, follow us on Apple or Spotify. The show comes out every week. There'll be good episodes coming up. We have our first interview coming up in the next week or two about some interesting stuff that is going to be a little more generalized that you can use in your day-to-day life. And if you like this show, you can also find me on social media under the username RealGIDoc. That's all. I'll see you next time.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.